Yay!
Hello, hello.
Hello, hello. How y'all ladies doing today?
Good. How are you?
I'm good. I'm good. As most people know, we had a storm this weekend, a freaking hurricane. It was the first in my lifetime. So it's just weird to like look out and it's like bright and sunny. Because usually if it rains like that for months. So to just have like intense rain and wind, and then it's like bright and beautiful outside just doesn't make any sense logically. But you know what? I am happy to be here and not flooded or anything. So how's everyone doing over there?
Good,
Texas?
good. Texas first. I love that you started with y'all, and I was like, Chris, what's happening?
You know what?
I'm a
I've been
Texan.
saying that forever, and people keep asking me if I'm like from Texas, but it was just like a Long Beach thing. People used to say, "What's up, y'all?" I don't
You
know.
can just say Liz, your work wife serving up on you.
Right?
Yeah, it's
Exactly.
fine. No, all is good. I'm so excited for today, and I'm excited to be here, but also like I know we're going to talk a lot about anxiety in school, and I'm like, is it really already end of August? Like, I don't know where time goes anymore. So it's a bizarre thing to feel like, wait a second. So like, we're already almost upon the fall season. Denise, how about you? How are you?
We're good. We had for the summer I was on Cape Cod and we were in the basement because we had like a major tornado warning. We had a tornado like a couple of miles from our house. So I'm very appreciative of the gorgeous weather today too.
Goodness. Oh, so
Yeah.
crazy.
Yeah.
Also, are there as many great white sharks in Cape Cod as I see? Because I see, so like for some reason, Denise knows this, but I went to the Northeast a couple weeks ago with my kids, and I like decided to follow this, like get this shark tracker where you can see where the sharks are. I'm petrified of sharks, by the way, you guys. And they're all in Cape Cod. And I'm like, what is happening there?
Yeah, it's true. It's one of the there's the most sharks, I think, on Cape Cod, or Cape Cod's one of the top few places that has the most sharks. So yes, but they're mostly on the outer Cape, and we also have a swimming pool, so we're on the beach. Or we're not
You're
on the
safe.
beach. Yeah, we're safe. Yeah.
Yeah. Okay. Well, I'm always just like, what? Why? Like, I don't know what's over there, but there's something. Okay. So important info, I know, but good to see you, Chris. Do you want to introduce today, and we'll just hop in?
Yeah, no, first I want to say hi. We got a bunch of people already saying hi to us. We have Matthew. It's great to see Matthew in the UK. We have Sarah from Houston. Dave, hi. It's always good to see Dave. We have Lovelana. We also have Nikki, who's from Ireland. We always get a lot of the international folks, international to us, because of the time that we're on. So please, as always, this is not just our live, this is your live. So make sure you comment, make sure you support each other in the chat, and make sure you ask questions. We're going to be focusing today primarily on kind of navigating OCD and related disorders, anxiety and depression as you enter back to school, whether it's middle school, high school, college, preschool. I mean, anybody, right? As a parent, you might be having a kid going back and have OCD yourself. I have a lot of parents that get anxious around this time because their kids are at school and the OCD likes to act up around that time. So super excited to talk about anxiety in the classroom, everything going back to school. But we also would love any questions. We'll save time at the end. So just a couple fun housekeeping real quick. Always remember that this live stream is really to give you resources, education, direction, support, community. We can't replace therapy. So if you really are looking for a treatment provider, one of the key parts of the IOCDF is providing you with a resource directory at iocdf.org/find-help. And there you can go and really look for a clinician in your area, in your state. There's a lot of telehealth options now who can provide you with one-on-one specific care for OCD and related disorders. If you are at a point right now where you don't feel safe, please remember that we're not a crisis hotline, and we want you instead to either dial 911, go to a local emergency room, or dial 988, or go to 988lifeline.org for the 988 suicide and crisis lifeline. And then finally, we want to create a safe space and be kind and respectful to everyone. So at the end of the day, we're all about supporting each other. And a note that this is being broadcast on several social media platforms and is being recorded. And as always, let us know where you're from. Who are you here to support? And are you somebody that is impacted by the fall, going back to school, whether you're a parent, a grandparent, a neighbor, a friend, a teacher, or somebody that goes to school? So we're really excited to talk about this. This has been a live stream that we've been doing each year around this time, and we get a lot of feedback that this is helpful because with transitions, OCD, anxiety can act up, and we're here to talk about it with an amazing guest. So Liz, do you have anything to chime in about it before we introduce our guest?
Yeah, I have so many questions, so I'm so excited. Denise is incredible. She's one of my great friends, but also a clinician who's been in the field and who was one of the original founders of OCDI, the first ever residential. I always want to say res, but then not everyone knows what I mean. But residential programs for OCD in McLean, Boston. And so Denise has a wealth of knowledge and background that I'm just so excited for everyone to get to learn from. And I'm just so happy you're here.
Thank you guys so much. I'm happy to be here with you guys too.
Awesome. Yeah, I want to say real quick, I'm really excited. I work with a lot of teens and young adults. That's not the only, age range I work with, but I mean, for a lot of my clients, there's a lot of stress because this is the first time they're going off to college, and this is a transition for them to move out of the home. A lot of my clients are going to high school for the first time, and they've gone through a K through 8, so they've known everyone, and now they're going into a high school. And the reason I wanted to mention parents and teachers is because I have a couple clients that are professors or teachers, and one of them is a professor, and he's in a support group that I run, and he's so anxious right now. So I think this time of year kind of brings out anxiety from everyone. And so I'm just excited, Denise. I feel like you're the go-to for this and help leading the foundation, all that it's doing for this age range. So we're just excited. Can you maybe introduce just what have you seen generally like around this time that makes it so unique for our community, and why some people really struggle or have to kind of like really hone in on their tools during this transition period?
Sure. I think the first thing is to say, like, going back to school jitters is normal for everybody, including parents or caregivers, because there's just so much uncertainty, right? About, friends and academics and teachers. And so for most people, that's going to fade after a few weeks. But it's the people who remain anxious, right? Those are the ones that we're worried about and that we want to, get them the help that they need if that's the case for them. But I think the people that are struggling the most are the ones who, like you said, Chris, are in transition. So kids who are going to a new school building, that could be middle school or high school, kids who are going into a new, like a new school district, or kids who maybe have a friend that moved away, or they're missing a big, they're one of their main teachers, or kids who are going away to college. I have a lot of people in my caseload too who are going away to college for the first time, and there's just like so much more uncertainty in those cases. So those are the people that we're, kind of focusing on. And as everybody on the live stream knows, transitions are hard, especially for people with OCD, because of that uncertainty, I think.
Yeah. And there's not, I mean, we're trying to create that, right? There's not like an anxiety roadmap. There's a school roadmap and people can go. But one of the things that my client that I just concluded with, because they're going to a state I can't see people in because of licensure. But what they were saying is like they felt that the school did a very solid job for like the general student. Like, here's the dorms, here's who you call, here's this. But it wasn't like a second one for the people that are really struggling with uncertainty, with doubt, with anxiety, with fear. And so there's not really a roadmap. So I know that that's one of the things the foundation has really tried to tackle at all ages, is like to create a sort of guide, a buddy. So can you maybe jump in a little bit, like what you see the direction of the foundation supporting students, parents, teachers, et cetera, all around the world?
Right. So I think when you Google like anxiety in school, I think that there's a lot of information, but it tends to be a little bit thin, is how I say it. Like they're sort of the same tips, the same general tips and tricks. And we at the foundation decided, like, because this is such a problem, that we wanted to create a program that was really going to go deep, and it was going to be tailored for teachers and parents and students, parents, caregivers, and students. And so we wrote the Anxiety in the Classroom program. And I think it's just loaded with tons of information because, parents don't always know. Parents know that they want to keep their kids safe and they want to make sure their kid is okay, but they don't necessarily know what to do. And it's a little bit scary to navigate the school system. Like, what are my kids' rights? How do I know how to access them? Are they being met? And so the Anxiety in the Classroom, website it provides people with like tons of information. We'll talk a little bit about that today, but if anybody wants to learn more about it, it's anxietyintheclassroom.org. So we're making a huge commitment to creating the program and then disseminating that information through our affiliates and through different live streams like this and different presentations that we're doing for educator conferences, etc. So we're making a huge commitment to that.
Totally, and we've seen such an increase, but I think that, as you've talked about, there's just so much to be known. And I love like the education and the commitment has just been incredible. But what I will say for those listening is so many people still don't know that we have this resource and that you can use it for yourself if you're a parent, you can use it for yourself if you're an individual, but also you can share it with your schools. I'll give a little bit of my own personal backstory, but when I was first diagnosed and was 15, going to school, I remember my mom coming up to the school with all these books and like handing each teacher a book, and she would give them, like, this was a long time ago, guys, but it was like Kissing Doorknobs and, you know, a few books that like she felt like, oh, these are quick reads. And I'll never forget, I had one teacher, Miss Diaz, who like actually took the time to read these books and read the brochures my mom had printed from back then it was OC, was it OCF? It was OCF, right?
Foundation, yeah, OCF.
OC Foundation before we were IOCDF. And so she, you know, and it was, I remember it being so useful for that, for me, for that relationship with that one teacher who took the time to read it, but it was a huge commitment, right? She had to like read all these books. And now to just think, oh my gosh, you can present this website to your counselors, to your school, to your teachers so that they can quickly browse through. And the reality is that it isn't going to be useful for them just for you. It's going to be useful for them for so many students.
Right. So we wrote it for anxiety in the classroom, not just OCD in the classroom. We did that for a couple of reasons. First one is when we did a little pilot study, a lot of educators said, we're not really seeing a lot of OCD, but we see anxiety. And then when you dug a little deeper, it really was OCD. So we named it, we rewrote it for anxiety and named it anxiety in the classroom, thinking teachers would access that and then later learn what OCD was. And then the second thing is when you have OCD, there's oftentimes a comorbid anxiety disorder. And so we wanted to write it for all anxiety. It's not just OCD, but there's an emphasis for OCD, but for all anxiety disorders in the educational setting. But what's really cool is that those of us that wrote it didn't just decide this is what we think people want to learn about. We sent out surveys and we got 1,000 respondents from educators. Here's what we want to learn about. And then we wrote what they wanted to learn about. And then we got 1,000, responses from parents. Here's what we want to learn about. Then we wrote about it. And then from students of all ages. And then we wrote about it. So it's like 3 different websites in one, specifically for educators and for parents and caregivers and for students. And I think that's what makes it really cool.
What do you see, if you were to sort of put your pulse on it, what would you see as the missing component? I mean, obviously anxiety in the classrooms is trying to address a lot of different issues, but what do you feel is like the main disconnect with schools? Because I think we all maybe could share like our own experiences with clients, our own personal experiences, but doing the pilot study, having some people go into the classrooms. I know there's been people, I spoke at a school before, I know Liz, as you have. What is like the main disconnect, do you feel, for schools to really understand OCD related disorders and help us diagnose early and get them care?
Right. I think that one thing that I really want to let people know is that OCD oftentimes is quiet. Right. And so it may look like many different things. So it might look like a student who's very distracted and they might be labeled as someone who doesn't really care, or they may have ADHD. It may look like a student who doesn't show up, and they're like, they just sort of disappear, or they don't really care about school. It may look like a student who is very bright, but doesn't hand in their homework. And it's like, person's lazy. They're disinterested. And so I think that if someone is in your classroom and they just seem off, they're not really on track, they're not really functioning up to capacity, dig a little deeper, because oftentimes there is anxiety underneath that, and the student really is unhappy with how things are going for them and really does want support. But many times anxious kids don't want to be a bother, they're ashamed or embarrassed, and it really is going to take an adult to go and try to help them really open up about what's going on. So dig a little deeper. If your student is struggling, it could very well be that there is an OCD or an anxiety foundation to what their presentation is.
Sorry, I left my water in the fridge, but I'm glad that you addressed some of those comorbidities or those misdiagnoses, because that's what I see a lot is my clients will have OCD and they'll get misdiagnosed by their teachers with ADHD. Not
Right.
that there's any wrong, obviously having anything wrong with having ADHD, but that's not what my client's experiencing. They can't focus because they have intrusive thoughts. They can't sit down in their seat because their seat has been contaminated or the teacher brushed up against them. They had a harm thought and they have to knock 3 times. So there's more focusing on doing that correctly. And so I get a lot of clients with that. A lot of clients get misdiagnosed with general anxiety, or they're not turning stuff in, so they don't care about school. Meanwhile, they can't turn stuff in because it's an odd day and odd days are bad. So I think that's probably, to me, that's kind of the mission, is like, how do we get schools to understand and at least be supportive? And even if they can't understand every subtype, not immediately suspect that this kid doesn't care, or, just learning disability or something like that, but getting them the proper diagnosis, because so many kids are misdiagnosed in schools, or misunderstood is a better word, maybe.
Right. And I think Amy just wrote a comment that was like, as a former teacher, I've never received one professional development on anxiety or OCD in my students. And I think that is many educators' experience, yet they based on the numbers, it's likely that you have at least a few students in your classroom that are struggling with anxiety, especially post COVID. I mean, we see the numbers weren't great to begin with. Post COVID, things have gotten a lot worse. One of the ways in which that manifests itself is in the classroom. And so, yes, I think that's what we're trying to do, is to meet that need. And in my experience, the teachers don't have to be the person to solve all the problems or have all the answers. But if a teacher understands something's going on with that kid, digs a little deeper, realizes that's anxiety, then he or she can use their own resources within the school setting, or collaborate with parents or outside therapists to help meet the needs of the kid. It's not like the hot potatoes in their lap only.
And I will say, not to give people more work, but if you are in a city or a place where there is a large anxiety or OCD program, for example, here in Houston, our program, we do trainings all the time in schools. So also, if you're a school and you're wanting to learn more, we can help give a training and use this website to help you understand training, but then continued support. And so, not that I'm putting that work on you, I think I just want to acknowledge that that is very clear work we know needs to be done. Like, we know that we need to be training counselors. We know we need to be training educators. We know that we need to be training more people on anxiety, right? If you think about historically, there has been more trainings for educators on behavioral interventions in the classroom, right? When because the teachers needed that, right? Years ago, there was just such a need of like, I don't know what to do when these kids are acting out behaviorally. And so schools put protocols and they put kind of resources and support in place. And so it is our job, and I just want to say that is why we do this work and why we are so actively involved with the foundation, is that we want anxiety to be something that is recognized the same degree that behavioral or substance use is in the schools.
Right, 100%. And all of us go into the schools and do these trainings, and the way that the website is set up and designed is that you could pull from it for like an hour long or a half day or a day long training for your school. I mean, we're putting those things together now so that you can actually download some of this information and sort of present it in the schools. But I want to say one more thing. So that was my thought on the disconnect within schools. I also just want to say that, speaking to any parents that are listening right now, one thing that I encounter a lot is sometimes parents are reluctant to tell the school what's going on with their child. My child's very anxious, or my child has OCD. They're afraid their child's going to go in their permanent record, or their teachers are going to, think negatively of their child. And I want to say that, in my 28 years of doing this, I haven't really ever seen that happen. I've only seen positive things occur when you are collaborating with your child's teachers, or the rest of the counseling staff to try to figure out what to do for your child. So if you are worried about that, I will just tell you, in my clinical experience, I would really encourage you to talk with the school and become part of the team, because I think that's when your child feels held and understood, and then we can move your child forward through some of this stuff.
What I want to add to parents is that don't be afraid to lean on your your child's provider. So for me, there was a private school in my area that was not giving any kind of support for kids with OCD. They just weren't. They were a private school. The counselor there could do what she wanted, and I had two clients that went to that school, and they wouldn't get any accommodations. And we'll get to Sarah's question in a second, because obviously we got to find that balance between like accommodations, but also, and what I was telling the school is like, look, this person doesn't necessarily need accommodations for their entire school career at this high school, but right now they're really struggling. And if you can work with me, they're in therapy with me to get to a point that they don't need these accommodations. But the accommodations this client needs are the same accommodations kids with ADHD need, or kids with learning disabilities. So it's not like you guys have to reinvent the wheel. You already have it in place, but you're just preventing my clients from getting help, because OCD isn't one of the disorders that you have lined up. And so luckily I was able to do a presentation, really talk. There's actually a really good talk that was at the OCD kids camp 2 years ago that I borrowed from, where it talked about struggles with sometimes with like processing speeds with kids with OCD, and was able to speak and get that change. So I want parents to know that, like, if you're getting nowhere with your school, most of the time, I think, Denise, you're correct. Like, schools are very, very open arms welcome. But if you're getting the block, lean on a provider, psychiatrist, et cetera, to maybe talk to that teacher, that school, that counselor, because we can sometimes make headway if a parent is finding that they're getting closed doors.
Absolutely agree with that.
Yeah.
Excuse me.
Yeah, I think just to pick up on one thing that you said, if a child has OCD, we sort of know, like, there's OCD triggers, but when a child is triggered, their ability to learn is impaired. It's like those of us that work with kids with OCD and anxiety, we consider it like a learning disability. There are executive functioning difficulties that go along with that. And so it's not just supporting on how to manage in the classroom, it's also making sure there are accommodations for learning as well. But a lot of that stuff's on the website. Like Chris said, if your child's in treatment, the treatment provider should be able to help you navigate that. And then, there's also educational advocates that can help you also if you're really feeling very stuck.
Yeah. So, and I just want to say, like, thank you, Denise, because I know how much work went into this, and I don't think you get enough credit. And so many of the volunteers and people who put their time and effort into this is such an incredible resource. And so, we want people to know about it, but I also want to know, I want to acknowledge the behind the scenes work from you, staff, and so many clinicians and others. So thank you for doing this.
Right. Steph Kogan and I sort of spearheaded it, but many people have come along since and edited and audited and contributed. So it's a group effort, as is most of the stuff we do at IOCDF, but thank you very much. It's labor of love.
Well, we appreciate it. So let's hop into some real examples. So I would love to just let's start for parents, but if you're a parent, your kid has gone back to school, they're about to, what are signs and symptoms that you should be looking for that would be like, let's first differentiate kind of signs and symptoms you might see that it's like, oh yeah, like that's something to kind of acknowledge or be aware of versus this is what warrants taking your child in for treatment.
Right. So I do want to say that there are some things that parents can do ahead of time for a child with any level of anxiety, right? And so some of those are, like making time to actually discuss the child's anxiety and validate their anxiety and help them problem solve it. It's also really good to have your child connect with peers, their friends, towards the end of the summer before the school year, participate in the back to school events at your school. If the school is open, ask for your child, especially if it's a new building, to be able to walk the halls, meet the teachers, see where their classrooms are going to be, get your child back to school routines like bedtime, wake up, picking out clothes, etc. So those are sort of the basic tips and tricks for all kids with anxiety. And like I said at the beginning of the live stream, a lot of times that will fade away for kids. But when we get we are really concerned when children, when it lasts, right? It's a high level and it persists over time, and it starts to make children not want to go to school. They might start refusing, right? It might be that the child has a very hard time separating. A lot of times kids have a hard time separating from their parents, but when they are tantruming and it lasts for a very long time and the child is inconsolable, that might be a time that you are concerned and you need to get professional help. Children with anxiety tend to have very physical symptoms. So a stomach ache or a headache, or they feel dizzy, they just don't feel good. And if those have been checked out by the pediatrician, primary care, and everything is fine, but they persist, that's another sign that there may be a lot of anxiety there. When a child, is capable, but is not turning in homework, is the test grades are very low, a child who is social, but doesn't have friends, or, is reluctant to do any sort of social things, or a child that may even stop talking. Those are the things that we'd really be looking at as markers that you may need to get some professional consultation here.
Yeah. And can you talk to me a little bit about the role of like pediatricians? Because one of the things that I see, and I don't know if this is your experience, Denise, is like sometimes parents will come to me when it's already like an explosion at school. Like we're working on stuff at the home and we're working on stuff in the child's anxiety and OCD. but then they'll come to me and say, can you sign this letter? My child's like 3 months behind on schoolwork and everything. And I'll ask, I'm like, oh, why haven't, you should have let me know. I could have supported you. And they're like, oh, we've been working with pediatrician or other doctors. So I think sometimes for some reason they're so used to meeting the medical and the pediatrician have a relationship because it's been with this kid forever. But I always tell the parents, like, they're not going to be able to do maybe what I can do. So can you maybe explain the role of like the team, the psychiatrist, the therapist, the school counselors? Like, if in a perfect world we could have a village work together, what's sort of everyone's role and how can they support the child?
Right. I think that pediatrician, like at the IOCDF, we're all about educating people and providing access to resources. And we really want to help get the word out, like screenings for OCD, right? And so I think we have pediatrician outreach and we're trying to help pediatricians. A lot of pediatricians' offices already have screenings for anxiety and depression. And we're really trying to help them understand anxiety and OCD are different, and so maybe, screening specifically for OCD. So that's one thing that we're trying to do to try to get more pediatricians on the treatment team. They're the first place that they see the kids and they want to track them over the course of time. We want them to be assessing for it. But sometimes pediatricians give medicine too, because the first line treatment, medication treatment for OCD are SSRIs. And many pediatricians feel comfortable prescribing SSRIs, especially because there aren't very many psychiatrists, child psychiatrists. People don't have access to that. So pediatricians are doing some of that work. I think what I would want to say to any pediatrician that was listening is that you would want your families to be getting access to mental health care. If there's an anxiety or an OCD diagnosis, please send them to IOCDF, but encourage them to get into treatment. And I know that it is difficult, probably more so now than ever, to find a therapist, but send them to the IOCDF. At least they get into our parent support groups, online support groups that Chris and his mom run, or anything like that. But in the perfect world, there is a me, in a Chris, in a Liz, there is a therapist who knows how to treat pediatric OCD or young adult OCD if we're talking about high school or college. And we can go in there and educate the schools. We can go in there and work with anybody on the counseling team who's going to be leading the 504 planning. 504 is an accommodation plan, or special ed if your child is on IEP. A psychiatrist might be there just to sort of support. They do the medication, but to support the weight behind some of the recommendations. A lot of the students that I work with have gotten neuropsychological testing, which is going to help diagnose things like ADHD, learning disabilities, slow processing speed, dyslexia, all things that sometimes are comorbid with OCD. Sometimes the neuropsychologists are involved in meeting with the schools to help come up with the accommodation plan. The parents, so important. Obviously, school personnel. And the older the kid is, the more I require them being part of the meetings to sort of discuss what's going on in the classroom and what we should be doing about it, because this is their experience. They have a wealth of information if you can get them to participate as to what will be helpful to them in the morning. I mean, in the classroom. As adults and as the treatment team, we oftentimes think we know what will be helpful, but it's really better to hear from the child about what you might say that will be helpful, what you might do that will be helpful.
Yeah, and at the end of the day, like what we're also trying to teach that child is to have buy-in to their treatment and to eventually become their own clinician. And if we're kind of, again, recreating that, like, mom and dad will figure it all out for you, or your treatment team, it's like, yeah, like, we actually want to empower and enable them to take on their own treatment, right? But to also set their own boundaries. I remember for myself that being so helpful when my principal was like, well, Liz, what do you think you need? What would be useful for you?
Right.
And I actually held myself to way higher standards and didn't give myself as much leniency as my clinicians. But it was like, oh, well, if you could do this for me, that'd be great. And they were like, yeah, sure. Like, we're happy to do that, because we were thinking we'd have to do a lot more.
Right. And like Matt said in the chat, avoidance is definitely a big symptom of people struggling with OCD. And so it might be that if you want your child we want your child to participate in the meeting, but they're uncomfortable, they can even participate by write a letter that we will present in the meeting, or let's talk about what you think would be helpful to say, or what would be helpful to do, and we'll bring it into the meeting. So any kind of representation, that's a perfectly fine place to start. They don't have to be sitting there under the spotlight, but then you'd slowly move them into the more active planning process. I think you're going to get more buy-in. I think you're just going to have a better plan. But in terms of treatment team, the school, generally the teacher, special ed, counseling department, sometimes the principal, the school psychologist, definitely a therapist if there's one involved, oftentimes the neuropsychologist, sometimes pediatrician and or psychiatrist if we need like doctor weight behind things, and parents and students.
Yeah, it really does take a village, and I think that's the important thing is trying to get as much resources and help. And what I usually find, because sometimes parents will be very overwhelmed, is I'll say in the beginning it is a little overwhelming, and I'll help you navigate as much as I can. But typically, like once things start getting going, it's a lot easier. So sometimes parents will be very overwhelmed, like how do I address the school? Who do I talk to, and all
Right.
that. The nice thing is I don't want the parents watching to think that that's going to be like a year-round job. It's like once it's up and going, most schools really have the systems in place to support. I think the big disconnect is they often understand generalized anxiety. They don't really understand OCD, and the things that go with it. And so that's where I think the anxiety in the classrooms, the foundation, the work that we keep doing is the more that we can educate. I think it was Amy in the chat said, it's like my sister was a teacher for many years, and she's like, we have these slots where anybody could come in, and the school has their kind of favorites that they bring in every year, but getting into schools, they want to have opportunities like this to educate on different things. I spoke at a school up north at the Menlo High School, and it was like the part of the reason they just selected me is they're like, we haven't heard an OCD and a BDD talk. We've done this great mental health presentation for like 15 years at the high school, and it's always anxiety and depression or eating disorders, but never OCD, never body dysmorphic disorder. And it was really helpful for them just to say, hey, now that you're talking about these things, these are things that we now pick up and pass students that we wish we would have known. So I think that's what's important is
Right.
is just educating them on the other ways that anxiety and OCD show up so they can
Right.
identify it early.
The other thing I find is it's like not just getting these trainings into the schools, not just getting these plans for the kids, but I also find that when I'm working with schools, I try to make myself available for consultation as time goes on because people like educators will learn, educators are learners, they want to learn, they learn, but sometimes there's lower confidence in applying what they've learned over the course of time the farther they've gotten away from the treatment. So if you are a school administrator watching this, or if you're an educator wanting to set this up, you could find someone like the three of us, in your local community that would do this, but also ask if they're available for office hours once a month, an hour once a month where people could drop in and just like ask questions, keep the education going. I think I have found that's the model that I use when I go into schools. And I found that it keeps the buy-in and it keeps people sort of on track with what the plans are. But for an individual student, yeah, use the therapist as like the way to keep things going with your kid. And yep, like Chris said, this is not going to be year round. Once you get things set and you get your support team, it'll be easier for you. And we would be fading out these supports over time as your child was getting better.
And I think the big thing here that's important to think about is that treatment is not a one and done, right? That like, yes, this big dose of education might happen up front, but as Denise said, we wouldn't expect educators to be comfortable. Actually, like, I hope you're a little skeptical about implementing it later or when something new pops up and like having a question. And we want you to ask us, right? Like, we want, like, those of us that are clinicians, it's our like honor, right? To be able to share like our knowledge, our background, what we see, what we don't see. And I would much prefer someone asks and someone asks for help or asks questions than they just assume or kind of just like, oh, we don't know how to deal with this, because I think that like Denise said is just so critical. And the same goes for parents. And I want to talk a little bit about that because I think this is a really important topic for today. Is a lot of times what I hear in the schools over and over again, and so parents, I'm a mom, we can all like take a deep breath before I say this, is I hear consistently with most of my trainings at schools that like, but the parents themselves also have anxiety. And I find that the schools struggle more with that than at times, I shouldn't say always, than with the kids with anxiety, because what they're able to acknowledge is like, yeah, sometimes we know what to do for the kids as far as like, we've been trained or we know how to tell them they should see this provider, they need to do this, but we don't feel comfortable. We feel comfortable saying, hey, you need to address your child's anxiety. This is the impact it's having, and here's why. But they don't always feel comfortable saying, Mom, like your anxiety is coming up, or your anxiety is problematic here, or, this school refusal case is like, it's more difficult, right? So how do you address that, Denise? And like, what do parents, clinicians do?
Right. Well, addressing it with empathy and compassion, because I think we're all in that boat. I got 3 kids too. 2 of them have anxiety, 2 have OCD, 1 has OCD, anxiety, and ADHD. Like, I get it. It's so hard. And this is what I do for a living. And, I've been in the schools with my kids advocating it. It is overwhelming, especially when you're met with some resistance. So I guess we'll just state the fact, right? Anxiety runs in families, and they're based on the data. It's oftentimes that anxious kids have anxious parents. And whenever I'm working with kids, I'm working with families in schools. And when I'm sitting with families, I say, this is a family plan. Like, everybody's going to be on a plan, because everybody's probably, despite their best intentions and best efforts, contributing to the problem in ways that may be a blind spot. So, like, if we're all aligned with, like, if our intention is to, like, help your child, and we know what the outcome looks like, we want your child to be okay, like, let's negotiate how we get there. And that is oftentimes means, like, the parents are going to have to be learning or practicing their own skills. And I'm just going to give you an example of what it means to have an anxious parent sort of contributing to the complexity of a situation. So if a child does not want to go to school and is happy, like, we finally get the child into school, it's like, the Herculean effort. There's a complicated plan with lots of different people, buying in and getting the child through the door. And then the parent sits in the parking lot in the car the entire time, because they are afraid of their child being left alone or feeling abandoned, or just they're worried for themselves. Like, if their child needs them, they want to be right there. That is going to complicate things. The child can look out the window and see mom. I want to go to mom. That is distracting. It sort of sends a message that, like, we don't have the confidence in you, child, to sort of handle this hard thing. And so, then you have to sort of coach the parent to drive away and go home and sit with the uncertainty of what's going on with school, and trust that we have a good plan, and trust that we know what to do, and, trust that your child will be okay. Also, like you said, school refusal, it is, it's imperative that we treat school refusal immediately, because the longer a child is out of school, the harder it is to get them back in, right? So harder to get the kids back to school on a Monday, after a winter break, after the summer, if they're going to a new school, after an illness. And so just know that those are the vulnerable times. We got to have a plan. And generally the plan is that the parents have to manage their own anxiety enough to be pushing the child to go to school, regardless of what the emotional presentation is earlier. I mean, obviously it's nuanced, and, it's an overgeneralization, but really, like, that's what the capacity has to be. And if a parent is not able to do that, it's going to be really hard to get the kid into school. And I run up against that a lot.
And if I could add to that, I work with a lot of clients with body dysmorphic disorder, and what's been hard for them is, it's like, some of the kids that I work with OCD that are refusing to go to school, parents will say, okay, we'll get you to an online school. And what I always talk to the parents about is, like, let's wave a magic wand. Your kid's OCD is gone. What is best for your kids' learning? So if an online school isn't the best for their learning, because they really need to be around other kids, they do better in person, let's not go that route. But what I find with my clients with BDD is they won't even go to online school, because now they have to look at themselves the whole day, but they won't go in-person school, and now they want to drop out. And I'm glad that you mentioned that, is because what I tell parents is, like, we got to address this early. Because, like you said, if it's now month 5 of them not being in school, it's like dragging a horse into that classroom. But if we can remind them, one thing that I like to do is, like, okay, what do you like about school? There must be some things. They play sports, or that's where they see their friends, or there's a girl they like, or there's a really nice counselor on campus. And so it's like trying to get people to go back earlier, because I'm glad you mentioned that, because I think sometimes parents will say, okay, we'll take a semester off and then we'll try again, if the school will allow, right? Like, I had a client who's gone before they saw me, like, a whole first year of freshman year because of OCD, and okay, we'll have them go back sophomore year. And I was like, actually, I think we should try to get them back starting January of freshman year, because I'm really nervous they're just going to get very comfortable. The OCD loves not going to school, because now your kid can spend more time with OCD versus being in class.
Avoidance is a slippery slope. One more thing I just want to say to parents about the school refusal. And again, like, there's absolutely no judgment. This is a very tricky thing. And if a child does not want to go, they will make it very difficult to get them to go. And the older they get, it's really hard to drag a 17-year-old kid into school. But the one thing that I try to do as a clinician is, that I'm making a plan that the parents need to implement in the morning. I make myself available, right? So I'm going to be on FaceTime, or I'm going to be on the call, because I'm supporting the parent and the kid. I try to take some of that heavy lifting from the parent onto me, so that the parent, because it's super hard and really overwhelming. So if you're working with a therapist around school refusal, I would ask them to be available during that really tricky time to make sure that you have the support you need to implement your part of the plan.
Yeah, this is kind of like what we were just talking about with teachers too, right? It's like it's one thing for us to come tell you what to do, but can we actually help coach you through tools in that moment, right? And parents need it too. It's one thing, it's easy for me to be like, oh, do this, this, and that. And like, this is gonna, and they're like, yeah, sounds great. Can you come do it? Like, this is,
You do it. Exactly.
yeah, like, yeah, if it's that easy, like, I love that you feel like this is no big deal, but no, I think it's us being able to, again, have empathy and understanding, but also be able to be there in those moments of difficulty, to be able to coach you through, to be able to walk you through it. And that's just so important.
Right.
So
let's just say one more thing. You would work with the staff, because the staff, there might be the lady in the front office that you really like. She could come out to the car to get your child. Like, there's other people within the educational system that can help with handoff and can help you with getting your child back in the school system. So, okay, that was my last thing.
Yeah. So my next question is, what are your recommendations for parents who have children that are displaying signs of anxiety, OCD? Maybe it's pretty prevalent, but the children are not willing to acknowledge it or seek treatment, right? Like, what do you do if you're a parent?
Right. So, I mean, I think one thing that I think, especially if there's an anxious parent, is that we jump to what to do about it. And I think that a lot of times we can just sort of hang back a little bit and make some observations. Like, I noticed that, your anxiety is making it hard to go to bed at night, or it's making you really tired. Or I noticed that you haven't been hanging out with your friends, and it seems like anxiety is really sort of getting in the way. Or making sure that if your child does feel like they bring up any little part of it, that you are ready for it, you're open, your own anxiety doesn't get in the way, you don't shut it down. Oftentimes, children are looking to say, like, if I say this, am I going to upset you? If I say this, are you going to be, are you going to be mad at me? Am I a bother? Am I going to really stress you out? So sort of look for those little nuggets of information, be available to them, validate them, make observations, just feed it forward. Sometimes you can then collaborate with the school and be like, are you seeing this? How can we work together to sort of address this? Another thing you can do if your child is really, really like resistant is you can contact a therapist yourself and say, hey, like, my kid's really struggling and he's really sort of clammed up and not really wanting to talk about it. What do you think we should do? Your therapist can guide you, but until you get there, I think also just spending time with your child, creating positive interactions, strengthening the relationship so that your child may end up feeling like more comfortable opening up to you. I think when they're little, they actually will. It's when the older they get, the more they sort of clam up. And so if you can take like an interested, validating approach without being overbearing and jumping to what we do about it or catastrophizing, I think you're setting up conditions in which it's much more likely that your child will say something to you.
I don't know if you find that this helps, Denise. One of the things that we've kind of gotten from parents and from kids in our family group that my mom and I run is there also has to be a relationship outside of the OCD. So if the only conversations are ever like, you need to get to treatment, you need to get to school, why aren't you doing that? You're doing a compulsion. Suddenly the parents no longer have a bond with their kids. They're almost like dictators or enforcers. And I always tell the parents, like, let us as therapists do that. We're not going to be dictators or enforcers, but let us be the ones that can really work with your child on the clinical skills. But you as a parent have to have some kind of relationship, because what I find is if a child's really close to their parents, the parents can talk to them in the morning when they're really struggling and kind of walk them through and coach them through the tools to get them to class, even if it's late, etc. Versus if there's no relationship, the kid's going to plant their foot in the ground. So I tell parents, like, I know sometimes you're frustrated with their choices of not giving into treatment or not going to school, and they're going to be a lot more receptive to somebody that they love and trust. And they always love them, but you know what I'm saying? Like, have a relationship and a bond outside of mental health with.
100% agree. It's like relationship, right? It could be parent-child, it could be therapist, client. It's all about the relationship, and it's in the context of that relationship that people will feel safe and secure and held and understood. And again, sometimes people shimmy up to disclosure or treatment in different ways. And so to maintain that connection while they're working through it, I think, again, it creates the conditions that it's much more likely for your child to say something. Also, kids who are struggling sometimes are hard, right? They're hard with their emotions and the way they express them because they're unskilled. They're hard with their behavior. And I think you just keep remembering that the hard is rooted in struggle. The heart is not rooted in being a jerk or not caring or being disrespectful. Your child is struggling. And if you keep reminding yourself that your child is struggling, that's rooted in struggle, you're going to interact with them much differently. And the other thing is, you also want to remind yourself that your behavior is a really good teaching tool, right? The way that you model handling these situations, like, is something that they're paying attention to, will learn from. So even if they are not like opening up completely, or they're kind of being jerky or really difficult, the way you handle yourself is a very powerful teaching tool. That's one way that you have influence over a situation that you feel really, overwhelmed by and like you don't have any say over.
Yeah, I remember I've had so many parents that are like, Liz, I want to be the mom, not the therapist. And I'm like, good. Like that's a good thing, right? Because again, I want you to be a mom. Like, I don't want you to go into therapist mode, or we even see this here at the clinic, right? Where like our RCs, sometimes we're like, hey, y'all are not enforcers. You're not like the people to police the BP. I want the patient to do that by themselves with their therapist, not you, because we kind of see these like home environments recreated, but we want to be thoughtful that like, people need to feel validated. They need to feel supported. They need to feel loved. They need to feel like, I know we talk a lot about this, is like siblings too, right? Like they struggle in different ways when there's anxiety in the system, but also the person with OCD sometimes gets jealous of like, well, you still treat my sibling like your child and you treat me like a patient with OCD. You'll hear people say things, patients say stuff like, I don't want to hear the word OCD again when I'm at home. Like it's too much. And so that relationship is just so much more critical than being this enforcer, right? But also, I do think the one thing I want to mix in there, Denise, that I would love for you to talk about is like, how can parents model the treatment through their own behavior? Like what advice do you have for parents of like, hey, let's think about what we're trying. Maybe you can explain that first, is like across the board, what are you trying to teach children with anxiety? And then how can parents model that same technique or that same learning that we want to take place for the kid?
Right. So for those of us that treat pediatric OCD and infuse acceptance and commitment therapy into the treatment, which is pretty much the frontline state-of-the-art treatment, we're trying to coach curiosity, flexibility, and willingness. So curious about what you're feeling, what is that making you want to do, how is that moving you toward the life you're trying to build or away from the life you're trying to build. Curiosity without judgment, flexibility to be thinking about things from a different perspective, thinking about things in a different way, and then willingness to feel uncomfortable, right? I'm probably gonna get this tattooed on my arm because I say it so many times all day when I'm doing therapy with people, trying to get people to get more comfortable being uncomfortable, right? So if you cannot feel anxiety or stress or sadness or frustration or anger, you're going to create a life in which you don't have to feel that. That is an avoidant lifestyle. So we're coaching curiosity, flexibility, and willingness to feel uncomfortable. And I think that we can do that in a lot of different ways. Like, wow, like if your child's like rare, you're like, wow, like you really seem upset today. Let's talk a little bit about what you're feeling and where that might be coming from. Or you're really frustrated today because you have to go to school. What is that making you want to do? It's making me want to stay in bed. Okay, well, so it's making you want to stay in bed. Like, I totally understand that. I would want to stay in bed too. But like, where's that going to get us? Let's magic wand it, like, Chris said, and like, let's see where that's going to take us. That's curiosity, flexibility. Well, so let's think about it from like your best friend's perspective. Like, they were really looking forward to seeing you today. You guys had like, it's twin day. You guys were wearing matching outfits. What do you think you're like, not a shaming or guilt, but more like, other people are going to miss you. You're whatever. So looking at it from a different perspective or more flexibly, and then willingness to feel uncomfortable. If you're a parent, you could be like, wow, like I'm going to give a really big presentation at work today. Like, I'm a little bit scared, but I'm also kind of excited. What do you think? You're modeling how you can handle your emotions, push yourself into bravery-based behavior. And again, like, I think like all of that is so powerful. I think we forget how much power we have as a model in all three of those different things.
I want to pause for a second because I resonate so much with this that like, for me, even like, right, we do this for a living, but like when I'm struggling at home with anything, right, like whatever I'm dealing with, like work stress or whatever it is, I feel like my go-to is to internalize that. And I think it's so bizarre actually to imagine like talking through it out loud. But then I'm sitting here thinking as you're talking, Denise, I'm like, oh my gosh, my kids don't get to see me modeling like having a hard day. And like, right. And so you think about like language, right? You tell your kids, you talk to them about all this stuff. You say, here's a tree and, you know, these things. And it's like, yeah, gosh, like, why is my go-to that if I'm struggling, like, I don't need to share that with them? It's like, no, actually, what would it be like to be like, wow, mom's feeling really tired today and I'm, you know, having some stomach cramps and like it's hard to get out of bed, but like I know that like if I get up and get some food, I might start feeling a little better and that like patients really need me today, right? Like that's just so like it's that little thing can be so profound for kids to see, oh, like I'm not the only one that has to have anxiety or feel distress or have difficult situations and work through it. But again, as parents, it's so easy for us to say like, well, yeah, life isn't easy. Life isn't fair, right? Like that's what we think a lot, but it's like, well, have we taught our kids that? Like, have we allowed them to see that we don't always feel that way, but we move through it?
Right. So my kids know I'm like, okay, I'm in business mode. My to-do list is really, really long. So if I'm walking around businessy, just know I'm working off my list. My plan is to do that for an hour and a half, and then you're going to get me back. You know, and they're like, okay. So if I'm walking around in business mode, they know what that is. Or it might be like, yeah, like there's just a lot going on. And like if I'm a little bit grouchy, I just want you to know this has nothing to do with you and feel free to call me out. Like it's just a normalization. We all have feelings. We all struggle. It's okay. And like let's put some words to it. The more your child understands what they feel, why, what it's making them want to do, and whether or not that's moving them forward to the life that they want, like that's like emotional education. The better off they're going to be, and we are great models.
No, I love it. Yeah. Even our spouses, right? Like our significant others, they don't hear us either. They're always like, why are you shutting down today? Why are you mad at me? And it's like, I don't want to talk. And then I'm like, why am I not just saying, hey, I'm having a hard day? Or like, here's what I'm going through. So like ignore it and recognize it versus like having to explain that I'm not mad at you. It just
Okay. So basically what just popped in my head is practice what we preach. We want our kids to face their anxiety or say what they feel or self-disclose. Like my child won't tell me that they're anxious. If we just had that question, right?
Yeah.
Right. Talking about how you struggle, like let's practice what we preach, right? As therapists, as parents, as whatever. So
I was going to see if Brennan could throw up Sarah Wagnon Hesterly's comment at 12:09 East Coast time. So it's back at the beginning, Brennan, sorry. But I think that, you know, we touched on it, but this idea of like, should accommodations stay? What are good accommodations? Which ones should fade over treatment? So Sarah says, I'd like to discuss enabling versus empowering. My daughter has an OCD and a pink pass to leave class a few minutes early since her symptoms are exacerbated at transition times. And then Sarah has OCD herself as a teacher. So she says, I left the face-to-face classroom and now teach online because my just right and hyper responsibility themes led to panic attacks, which probably meant she couldn't focus in class. When accommodations make us feel so much better and supported in the system, where do we draw this line? So how do people sort of navigate like what is maybe a better fit for their child or her as a teacher versus like this should just be temporary? Like how do people navigate that?
Right. So let's start with the student first. So accommodations, like, so again, working with pediatric OCD, work with schools and parents. When I do parent talks, we're talking about reduce parent accommodation. When I'm talking to schools, I'm like, let's put in accommodations. And so sometimes it's a mixed message, but with schools, accommodations are a part of like a 504 plan or an IEP. IEP is special education. Many students with OCD don't meet special education criteria. They can get a 504 plan. And in the 504 plan, we list accommodations. And what we're trying to do is create a level playing field that we want these things in place so your child can learn. Accommodations are not treatment. You know, it's not a treatment environment. It is a create a learning environment for your child. And so if your child is in treatment and I have something on there like, you know, they can get a 2-day or a day extension on written assignments, know that in treatment, I'm working on the OCD that slows them down with writing, and that as their treatment progresses, that accommodation is probably going to fall off. So accommodations are not necessarily meant to stay forever. If a child is in treatment, you would expect that they would drop off. Okay. So a lot of times schools are like, but aren't we just giving into the OCD? I'm like, this is not a treatment plan. This is an accommodation plan so your child can learn. And then for teachers, I mean, I think it's, you know, the Americans with Disabilities Act is reasonable accommodations. Like what allows you to do your job? It might be that you went to online learning because of the panic attacks and hyper responsibility. But if you were in treatment and really valued getting back to the classroom, You might be in treatment to help you with those things to move you back to the classroom. Or it might be that there's other things going on in your life and you're like, hey, I'm online teaching. That's fine for me. I have other things that I need to work on in my life and I'm not going to really do that one right now. That would just be based on, like, again, what you want for yourself, what kind of life you're trying to build, what kind of direction are you trying to go. You might be perfectly happy there and you have other priorities, or you might really want to get back to face-to-face teaching, and that would be something you take up in treatment as a priority.
Yeah, and as a clinician, I would do what Chris did earlier and talked about, right? Is I would want to know, like, if you didn't have anxiety or OCD, where would you be teaching? And if you're like, definitely in the classroom, it's like, okay, well then we're going to get you back to the classroom. But if you're like, honestly, online, I like wearing sweatpants, I don't really want to have to go in. It's like, great. And how can we make sure it's not serving as avoidance and feeding anxiety and OCD? So can you still go do a talk at a school or go do something where you're still going to be around
person? Exactly. Yeah,
crowds and people or whatever it might be, so that yeah, actually, like, this isn't rooted in avoidance, this is rooted in preference. But it's a great question. It's one we get all the time. And I love what Denise said about accommodations. And I just want to throw that out there, is I think there is so many people, even people with OCD, you guys, where, like, those of us with OCD, I'll hear people all the time saying, well, my work shouldn't make me do this, or they shouldn't make me do that, or I shouldn't, right? And my answer is always like, actually, like, I don't want to fragilize you. And I don't want individuals to start to send the message to you that because you have OCD, you can't be treated the same as someone without OCD, or that it is going to hold you back. And so I want us to remember, whether it's the workplace, whether it's education, it doesn't really matter. Accommodation are a means to help move you through treatment, but they are not a forever goal, right? I talk about this a lot. We can do a webinar on this. There's so many to do on rumination disruption, right? Like, rumination disruption can be helpful while you are trying to, like, get somewhere and move through it, but it is not a treatment, right? For treatment, I don't want you constantly having to disrupt your rumination. I want to get to the core of why you're ruminating and be able to actually make it where you don't even have the urge to ruminate, right? So again, think about it as a stepping stone and not as a treatment intervention when we're talking about accommodations.
Right. Perfect.
Well said. I mean, I think that's the goal for all of it, right? Like, even clients that are struggling with work stuff, it's like, okay, what is the thing? We were talking a little bit, Denise, before the live stream started. You and Brendan were talking about, like, going in the office versus staying at home. And it just, like you were saying, Liz and Denise, what I would tell my clients, if you love working at home and the thought of driving on an LA freeway for an hour makes you want to melt again, don't. But if you're not working in the office strictly because of OCD, is there other ways that we can challenge the OCD without you having to go back to the office if you hate it, right? Like, finding those ways that people can get that freedom. And I think we did a live stream a couple of weeks ago with Allegra about, like, trusting yourself in treatment, but the conversation went bigger about, like, what should expectations be? And what I always tell clients is, like, the way that I consider recovery, myself and others, is are at least 99.5% of all your daily choices your choices, and OCD doesn't even get a say in it. And that's what we want to get back to.
Okay, that is exactly what I say to people all the time. How do we differentiate based on that question? We want you to be at choice. Treatment is about giving you the choice to go back or to not go back. Not the OCD gets to get the choice. You get the choice. That's when we know we've been successful in treatment.
Oh my gosh, I love that so much. I've never heard it said in that. Let's make a Denise Egan-Stack quote. And it's like, that's going to be like on our homepage, right? Is that treatment is about giving you the choice, right? And I tell our patients that all the time. When you leave, like, I don't expect that you have zero OCD triggers right? But I expect you to be at a point where you know what to do with them and you can choose to have a life.
Your choice.
Freedom, right? I love that. Your choice. That's so well said. I was just thinking as we were talking, you guys, there's so many webinars we need to do, Denise, with you. So,
can I come back? Yeah.
Please, no, we're going to have you back whether you want to or not, but, like, boundary setting, accommodation specifically, right? Talking through some cases of what that would look like. How do you build that treatment team you were talking about earlier, like this really comprehensive, great treatment team? It's like, okay, but where do people start, and how do we help them get the right provider? Because really a provider should help dictate the treatment team as well. But, like, how do they know they're with a good provider? There's so many questions and so much to be done, but I know we're out of time for today, but thank you. This is so helpful, not just for individuals with OCD, but for parents, for caregivers, and of course for educators. And I'm just so excited to see the website, the tools, the resources be used more and more and be able to help more people. We're so grateful for you. So thank you for everything. And I'll let Chris say a little, and then Denise can have the final words.
Yeah, what I'll just say really quickly is we got a couple early questions before the stream started about hoarding and one about the role of diet. So one of the things that we always do is we take any questions we didn't get to the live. We have a questions document, so I'll make sure to get those. So Spence and SP, we promise we'll get to your question. The second thing I want to say is don't forget to go to the IOCDF's page on their conferences. The online OCD conference is Saturday, October 21st and Sunday, October 22nd, and you can register now. But my final thought is if you got anything from it, if you joined us late, or if this is going to help somebody else, don't forget that these remain on the IOCDF's YouTube page. So just youtube.com/IOCDF. They do really great afterwards. This is like, we were fortunate, Liz and I were fortunate to be able to pick Denise's brain. I feel like this was a very thank you, Denise, like a very overview, very comprehensive. We touched on siblings, we touched on accommodations. So if you or a loved one or someone in your life is impacted by OCD, anxiety, etc., besides going to anxiety in the classroom, really share this live, because I think there's something in it that will really answer some of their questions that can make a biggest difference in your loved one's life when it comes to education.
Right. And I just want to say thank you guys for having me. I love chatting with you guys. It's always just like we're hanging out, which I really appreciate. I think this talk, but everyone you do is just so helpful and so impactful. And for everybody listening, if this is something that's, if you're really impacted by your child or yourself or as a professional, there's hope. We're here for you, and we're building the programs, and we're really open to feedback too. So thank you guys all.
Lastly, Denise or Liz, you got to say the website one more time.
IOCDF.org/peace of mind, or what you mean anxiety in the classroom?
That one too, yeah. All of them. Throw them all out there.
Sorry, guys. I'm like, the one that usually is the banner. Yeah, Denise, tell everyone where to go and find the content and how to navigate the website. Sorry, guys.
Bye, guys.
Go to anxiety.
IOCDF.org.
Anxietyintheclassroom.org.